Chuan. Yung Chuan. Y-O-N-G-Q-U-A-N. Yung Chuan. Now where this point is located, here I wanted to tell you there are the two locations. I'll tell you, keep it in the mind. One location to be known as a point 1 chun. Point 1 chun. Proximal to the medial corner of the nail base of the pinky toe to be known as a K1 point. The second location to be known as a on the sole of the foot, anterior to the 1/3, posterior to the 2/3 of the sole of the foot, that to be known as a K1. The another location to understand, when the patient is sitting or the patient is lying on the supine position, the leg is on the direct direction, then when the sole of the foot, when he squeezes the highest point of the depression to be known as a K1, midway between the second toe and then third toe, midway between the second toe and then third toe. Where is the highest point of the depression? On the anterior 1/3 region, that to be known as a K1 point, Yung Chuan. It is a beautiful point for the day-to-day clinical practice. Normally we used to apply for the number of the cases. You know, there is only the one point of the earth point which is connecting to the earth meridian, earth organ, that to be known as a K1 point. No doubt this point belongs to the wood point, but wood point is the first point of the kidney, but at the same time this point is earth connecting point to be known as a K1 point. No doubt the foot reflexology, having the hundreds of the points, are located on the sole of the foot, and how the reflexology of the hand is existing, in the similar way sole of the foot also existing. By the way, that's called as a micro acupressure or the micro reflexology, but this to be known as a macro acupuncture point to be known as a K1. That is the only one acupuncture point. Overall you can see the head to toe we have 411 points. Out of that we have the only single point on the sole of the foot which is connecting to the earth, because you know there is the whole man is divided into three segments. One to be known as a heaven, the second to be known as a human, the third to be known as a earth. So therefore the human and then earth is connecting point to be known as a beautiful lovable point to be known as a K1 point, Yung Chuan. So Yung Chuan is emergency point, and also this is opening point to your central nervous system, and also it is the vasoconstrictor and vasodilatation point as well. When there is the vasoconstriction to be taken place, where the blood vessel got contracted, and due to that reason got the syncope, due to that reason got the apoplexy, due to that reason got the unconsciousness. So due to that time, certainly the fainting, coma, shock or drowning, any particular serious condition where the retention of the urine is not passing because of the prostate gland related problem or something connected to when the kidney malfunction is there, so that time the creatinine level shoots up and the filtration process is not taken place. But however, bladder got filled with the nearly 600 to 1000 ml of the fluid is got the retention in the urinary bladder with the dilatation level, or it happen expanded level, that the urine is not coming out. That particular time just you puncture to that particular point, because it is the emergency point to open up the brine. The brine, it gives a signal to the bladder that open up the urethra. So once it get the urethra is open, then the retention of the urine is slowly it comes out through the urethra. So thereby it is the multiple reason can be used at this particular point. since this point is located on the sole of the foot and the patient are suffering for the diabetes neuropathic conditions, that time the patient feel I do have the numbness condition, but when I use my sandal or chappals, I couldn't recognize whether my chappal is there on my sole of the foot or not there. So that level the patient cannot identify even that condition. You can use this specific point. This will be useful to treat for the neuropathic condition. Diabetic neuropathy or the non-diabetic neuropathy also can be treatable. By the way, some of the children or the adults, they do have the perspiration on the sole of the foot or sometimes of the palms. Even that condition also to come down drastically, you can use the 2 points. One point to be known as a, keep it in the mind, one point to be known as a Yung Chuan. The second point which I told you, 1/3 anterior to the sole of the foot, I told you. This point is 1/3 the sole of the foot. The second point to be known as a 2/3 from the anterior region. This point to be known as a anterior part of the heel region. You can use it this point and also you can use this together point. Both the points. This I am just telling as a traditional Chinese medicine philosophy and also Taiwan philosophy integratedly. You can use both the points are great point to treat and open up to the central nervous system, especially brain. The patient will be within short period when he got the unconsciousness or on the road somebody is got fainting. So that time also it is advisable. On the road somebody is got fainting or shock or coma or some kind of the bleeding to be taken place, unconsciousness level. Even sir told me this emergency point, you are passing on the road. By the way, that is the medico-legal case, that MLC case. So that time you shouldn't do any kind of the treatment. By the way, you wanted to do without the knowledge of their without the knowledge of somebody, then you wanted to do as use the toothpick and then give the pressure. You just take the keys and then give the pressure. You take something as the object of the metal, you just give the pressure on that region. The people should not recognize you are doing the treatment, but your intention is good, but tomorrow you will be the evidence for that. Perhaps he got the collapse, totally he collapsed, he has gone to the heaven. That time definitely will be the problem to you, that you have made something to cause that problem. You injected something, due to that reason he got the collapse. That will not come to you. However, you can do something, but in the centers normally you apply the 2 points. When the sitting posture, you just apply the knee one, around maybe 25 people are here, but if we apply around the knee one to all of you, if I apply to knee one, that is the P6 in the sitting posture, maybe half of the people will collapse here. Slowly you'll get fainting. In our center, day before yesterday, we applied the one needle. I think somebody is there evidence or I don't know. But the patient is sitting in front of me. Then we put it the needle, that because no place on the bed. So they are very emergency, wanted to go to Mysuru. Then I just applied the knee one on sitting posture. But I have given the alertness to my staff, please take care. Maybe she'll get the fainting. Then after some period of time, I think where is Motu? He only took to the bed to that woman. So emergency got that syncope. So that means indicating that kind of the syncope. Then it is advisable. You can do the needling on the K1 point. Otherwise, you just lift the leg to the upward direction above the heart level. You just lift and hold it for a few minutes. Then the blood flows to the brain system. Then the patient will become the consciousness. So by the way, you can do the multiple ways. You just apply the K1. If it is in the center, it is happen, then you need not to worry. Timely will get the syncope. That is the very less oxygen to apply for timely, momentarily to the brain system, which leads to that problem. Thereby, you need not to worry. This is the benign complication of the acupuncture. In the day-to-day clinical practice, we used to see that. So that particular time, you just apply the K1 point. Within 2 minutes, the survival to be taken place. Even for the dead body, you wanted to know, because now at the time of the termination of the life, maybe that time the patient will be now shaking the legs or maybe closing the eyes. The pupil of the eyes is dilated, and that time there is numbness is there on the hands, chillness is there. But where is the chillness? The the heaven, that soul goes from the head, the soul goes from the facial region, or soul goes from the hands, or the soul goes from the leg region. So that time you wanted to know that where exactly that person is alive or may not be alive. That time you wanted to know, somebody is emergency calling you, please come, my father is getting some kind of the gasping is taken place. So that time you are going to that particular time on that place, then the patient is terminated the life, soul has been taken by the Almighty. Then that time you are thinking that whether the person having the heart rate or not there, person is living or not living. Then you wanted to reconfirm once again. There are the many parameters are there. Maybe living people I can see that more than 25% of the patient I cannot see pulse, that indicating you are died. It's not like that, but you cannot predict by using that. By the way, you wanted to know what could be the other reasons. The eyes are dilated. The third one is there is no lub and dub, and then sounds are not there, and pulse you cannot see it, and the palpation, this is no, the hands are very chillness, but legs are slightly warm is there, but through legs the soul is passing out. Then you just insert the needle on the sole of the foot, then immediately he will shrink that the soul, so he pull the leg. So that time you recognize his body is still alive. When the body is totally terminated, the soul has been not there. So that time you wanted to apply the needle, then reconfirm that yes, the person is totally dead. But however, the warmness is there, but the sounds are not there, but there is some kind of the very, very tiny sounds are there on the cardiac system. Now it is going, now the prana is going away now. So at that particular time, but only acupuncturist don't consider that you cannot totally give us a death certificate to somebody. Perhaps can be given, but still ethically, legally, you cannot provide that this is the death certificate to them, because we do require the registration number. So based on that perspective, the people will recognize as you are qualified, and then you have done this kind of the act. Due to that reason, I suggest you, but medical doctors who are the naturopath or some other doctors, Ayush doctors or the medical doctors, certainly they can give, either they do have the A class registration, B class registration, C class registration, even the fast board registration will help you one or other way to be given as a registration number, so that you can put the seal and signature and consider. Third, if the patient is so going to die now or died now, but don't take it the entire risk on your head. Better if you are totally know that the person is expired totally, then you can say it is no more, but still you put one word to the patient, that means the attenders, that please you just take to some other hospital also for the further identification of totally it is dead or partially. They can do the revival called as a CPR test, the giving the pressure on the chest region to bring up the cardiac rate. Once the cardiac rate it comes back, then chances are there for the survival. Better we can send to somebody else. This is the one condition. But at the same time, the people who are suffering for the dizziness, fatigueness, lethargy, so that reason also it is advisable to use K1 point. By the way, the major indication to be known as a one is the dizziness. The second connecting point, since this point belongs to the command point, so therefore the command point is the K1 is connecting to the liver. So liver is strengthening, liver is connecting to the brain system indirectly. So therefore once you applied the K1 point is equivalent to the liver 8, that to be known as a Chuan. K1 is equivalent to the liver 8. You just use the liver 8 or you can use the K1. Both the functions are same. But the more predominantly functioning point to be known as a superior point to be known as a K1 point is the wood point. K1 is the wood point will be strengthening to the kidneys and also strengthening to the liver. Sir, being a sun point, how will going to strengthen? However, you just use the sun point or the mother point, grandmother, grandson point. But once you do the treatment, again if the getting the less energy of the kidney, again it restore the kidney energy once again if we apply the K1 point. That's the reason K1 is the very, very great point. Do you know the TCM says that the head problem treatable down point treatable on the top, vice versa. Therefore, all the head related disorders can be treatable by activating the K1 point. K1 point, when that's the reason foot motor area is existing on the scalp region, you treat the foot motor area on the 112 needles on the anterior region of the head region, that regulating to the sole of the foot region as well. So thereby both the conditions, head related problem, toe related problem, treatable. That's the reason whenever you wanted to apply the K1 point, remember K1 point applied towards the one particular point, that to be known as a thigh chung. That is the liver 3 point. So once you apply the liver 3 should reach to the K1, K1 should reach to the liver 3. Liver 3, you know, is the great point to treat for the migraine or the scalp related disorders. So thereby K1 also treatable towards the liver 3, because liver is taking care for the all the head and neck related disorder. By the way, kidney also strengthening to the bones and also regulating to the brain function as well. So maximum diseases, one particular point. So the nearly hundreds of the diseases can be treatable by activating the single point. That point to be known as a K1.